we have commissioned the satellite laboratory in Lira City. It is a laboratory that is ultra-modern and will serve the entire Lango sub-region and beyond. We have ultra-modern equipment in this laboratory, and we are able to do all the tests that anyone would require in clinical practice. More equipment is being brought and will be installed so that we are able to expand the capacity of the laboratory. It has sections for parasitology, immunology, cancer markers, cardiac markers, hematology, biochemistry, and many others. We are excited that we have such a valuable asset here in Lira City. This asset cost 4.5 billion Uganda shillings. And it was part of the resources that we got through the Uganda COVID-19 Response and Emergency Preparedness Project.
So our team just needs to be there to make sure that they provide the service, and they need your support. They need the support of everyone, each one of us here. To our health workers, we want to thank you, Dr. Dul, and your team, and the specialists, and the nurses, and everybody who works in this hospital. We want to thank you for improving the service delivery. Government is continuing to invest in the hospital to make sure that the services get better. We want also the health workers that we improve on our attitude. We want to thank the health workers, the laboratory staff. We saw a lot of changes, a lot of improvement, and we thank you for working hard to make sure that we attained accreditation. Accreditation is the highest level of service in the laboratory, where you are ranked at international level. We want to thank you so much.
Lira Regional Referral Hospital in the past was utilizing a laboratory service with a limited capacity. The biggest challenge that we had was that we were unable to do advanced testings. We did not have sophisticated machines to investigate the patients within the region. In the past, for tests that we were not able to do at Lira Regional Referral Hospital, it's again packed and then taken to Kampala, where we call Central Public Health Laboratory, CPHL, that will do all these tests, or Uganda Virus Research Institute, and eventually they will bring the results back for us to manage the patients. The new satellite laboratory, which was constructed by support from Ministry of Health and other partners like World Bank, is valued at 4.5 billion shillings. This laboratory is coming along with a very important aspect like equipment which is able to do very advanced testing. We'll be able to test infectious diseases with outbreak nature, and these diseases will include conditions like Ebola, which is a viral hemorrhagic fever. We'll also be able to test viruses like Marburg, and you know that as a country we have had challenges with these viral hemorrhagic fevers, but with this enhanced capacity of the lab, we'll be able to test for this locally here in Lira Regional Referral Hospital. The lab also comes with additional support where we'll be able to test detailed conditions of the patients better. People with high blood pressure, diabetes, HIV, sickle cell disease, even the malaria that is still a problem in our area. we have now better capacity with machines, and this will be tested within Lira Regional Referral new laboratory. This laboratory also is going to provide an opportunity to support the lower facilities within Lamu sub-region. We know that it is the only lab actually now in the greater northern Uganda with that capacity stretching from I think Teso sub-region, Karamoja, Lamu, Acholi and West Nile. There is no such lab. So we are really blessed to have this.
It is one of its kind in this region or in the country with the state-of-the-art equipment and the infrastructure. This is an accredited lab to international standards. We were accredited in 2022, and it's one of the labs in Uganda with the highest number of accredited tests. Accreditation comes with, as you were saying when you were coming to my office, you saw a banner. We are accredited to ISO 15189-2022, and we have been assessed and we sustained our accreditation. Accreditation comes with lots of benefits. We have quite a number of departments, and we have now been expanded. We are very, very grateful. That's why when you were moving around, we saw staff, so I'm really very happy to talk to you. We have over 12 departments. One, we have parasitology department where we run routine diagnostic tests like HIV, malaria, microscopy, malaria RDT, syphilis, HIV, all those, and urinalysis, all those microscopic tests, we run them there. Then we have another department that is hematology, a department where we are able to do full blood count. To see if somebody has infection, check on the HB level, and also help us to give a picture if somebody maybe is having some tumor markers, some cancer. Because when you look at the picture of the full blood count, we are able to tell whether somebody could be even having cancer, because, like, for example, if you have repeated raised absolute white blood cell count, can give us a picture of how to go ahead with such patients.
Thank you very much. I am called Mary Apaki. I'm a senior lab technician. I head this section called microbiology. This section is majorly for culture and sensitivity. We culture all the samples that are in this hospital. And this department is a very new department. We didn't have it before. It was a department that Lamu sub-region did not have. And when a patient wanted culture and sensitivity, they would be referred to Mulago. Culture and sensitivity is just growing bacteria. When bacteria grows, you now know, you identify which bacteria is that, then you set the drugs that can kill the bacteria. So that is what we are doing. So when we are giving result, you give out the result of the antibiotics that will kill that specific bacteria. So that service has not been there in Lamu sub-region. And this section was open in 2021. Equipment. When we started, we did not have things like autoclave for sterilizing our media. We used to borrow. From this other department, the male surgery. We didn't have the weighing scale. We had so many problems. But right now, as you see us, my dear, we are like in UK. That is going to identify the bacteria for us and set for us the drugs, the antibiotics. There is no more going to be manual work. It is the machine going to do it. You make the suspension of isolate. After you load to this machine, it's a filter, it's for filtering. Then after filtering, you go to the loader. After loading, the machine now will do its work. It will take like 24 hours.
What do you load there?
You load the samples. Yes, you load the isolates, the bacteria itself, let me say.
and this is where we receive samples from all the units which request for culture and sensitivity. We receive them here, accession them in the register, first log them here, this specimen register, and give them unique numbers. Yeah. After giving them unique numbers, we now create a plan in this book here called a worker plan book. Okay. After creating a plan on whatever we are going to do on that sample, we now go ahead and process them in that next room where we can go. So, when the samples come here, this is where we process them. This bench here is where we process the samples, as you can see. Right now, these samples, we received them yesterday, and we cultured them yesterday. So we have identified we are following up the organisms by setting biochemicals, as you can see. Yeah. And some of them we are going to set antibiotic discs for the drugs which will kill some of the bacteria. So we are in that process right now, and you can see we have the media here, Muller-Hinton media, where we set the sensitivity pattern. Then we have some of the biochemicals like a urea, like a SIM, and others if you mention. Yeah. And whatever we do here, when we get the specimens, we culture them on media. For example, this one's blood agar. Yeah. And there are others like maconke, and chocolate. This is of course a microscope where we examine our gram stains and wet preparations here. And it's a very nice microscope, CX41. Very nice. You can view everything as you wish. Then this machine here, it's called a Bactec machine. It is a FX200. FX200 means you can load 200 samples inside here. For example, this side, we call them worker stations. Yeah. So this side has 100, this side also has 100.
My name is Tim Samuel. I'm a medical lab assistant, and in this mighty lab of the Referral Hospital, I'm the equipment officer. So this is chemistry department where we do a lot of tests that are organ functional tests. We have several machines that are automated. We have the chemistry analyzer, which we call Cobas C311. It is an organ functional machine which tests things like liver functional tests, renal functional tests. We can do lipid profile, and also we can do other assays. For example, the CRP, that is C-reactive protein. We can be able to do D-dimers to assess for certain proteins due to inflammation in the injuries. Yes, this machine runs so many tests, and it has a good turnaround time, meaning that it can do more than 100 tests per hour. Yes. Then we have also another equipment called Cobas E411. So this equipment here, it's really very good. It's called Cobas E411. It is ECL analyzer or immunochemistry analyzer. We use it to do organ functional tests and then hormones. Among the many tests it can do, it does thyroid functional tests, which includes the T4, T3, TSH, there is FT3, FT4. Then it also does envelope antigen tests for hepatitis B. This equipment here can do fertility tests, for example the TSH and so on. Then it can also do what we call CRP, and then also the total prostate surface antigen test. So this equipment also can do heart functional tests, or what we call cardiac markers or cardiac tests, for example the troponin, the CKMB, and then others. So this is the equipment we have. It can do more than 50 tests per hour. It has really helped us to manage patients that are really on ward, and then also the walk-in patients. Here we have QMaster 200. It is also a chemistry analyzer. This machine here, as you can see, it is automated. It can run several tests, including liver functional tests to assess the functionality of the liver. It also does renal functional tests to assess the kidneys. Then also it can do electrolytes, since it has the Humalite Plus near it. This machine is user-friendly and its turnaround time is also okay. It can run more than 50 tests. Actually, it can go even up to 200 tests per hour. That's why it's called QMaster 200. Then also it can do other tests such as the glycated hemoglobin. We can use it to monitor diabetes. We can use it to monitor certain ions and electrons in the body. That's what the equipment can do.
My name is called Okelo Samuel. I'm a laboratory technician. I'm the one heading the hematology department at the moment. So generally, the whole of this room is housing hematology equipment. So to begin with, I have here CBC machine. This one. What does it stand for? CBC? The CBC means complete blood count. Complete blood count. Yes. So this one we examine blood, white blood cells, red blood cells, platelets, to determine certain conditions like infection, anemia, and some cancer using the CBC machine. The name of this machine is called SysMed SN550. It is a 5-part machine and it is fully automated, and it is the one we use to do CBC.
I am Mr. Ulumu Boniface, currently working as a laboratory technician, but laboratory technologist by qualification. Now I'm going to introduce for you another machine for full blood count, or CBC, which is called ES Celtag. It's a neonicotine from the China company, which they produce to quantify the number of white blood cells, red blood cells, platelets, and also to detect some abnormalities with red cells indices. So now, because we have other machines which we have talked of, now this one comes another machine which is very user-friendly. Actually, it's rapid and it will involve the use of very little samples. Even pediatric samples can be run. So in some cases where patients we cannot get enough sample for other machines, this one can really help us to run those for pediatric patients. Now, because we have been having tests with those other machines, this has also helped us a lot, though we could have enough tests in the facility. So we have enough equipment for full blood count, and this is also one of the best machines I've ever used. Yes. Secondly, this is a full hematology lab, and we have another machine called the Gazaris machine, produced to do HB electrophoresis or hemoglobin electrophoresis, for which we have a quite number of patients who need sickle cell test. And this machine does those tests for detecting the variants of hemoglobin, like hemoglobin S, hemoglobin AS, which is a carrier kind of. So sicklers are always diagnosed using this machine, and it's a confirmatory test for sickle cell. We have just received them, but it's already working. The third machine I'm going to talk about is the Sysmex CA104, which is a coagulometer machine. It is used to detect bleeding disorders and coagulation studies. So we have the tests like the clotting factors, those clotting factors like factor 8, factor 9, prothrombin time test, activated partial thromboplastin time. This would help us to detect the bleeding disorders and coagulopathies. Of course, when patients are being admitted, some of them need surgery. Then after surgery, still we need to monitor this patient. We are using this machine, which is a nice one, and although it's a semi-automated machine, we have used it quite a number of time. So